I'm going to play you real-life audio of terminal secretions. And before you freak out and scroll on, let me tell you why I think this is important. So many of my followers and my patients' families tell me how when they first heard terminal secretions, or AKA the death rattle, it really scared them. It really made them feel like their loved one was suffering and suffocating, and they just thought it was like a traumatizing experience during the death and dying process. This is a very misunderstood sound, and I think it's important that I have you listen to it and then explain what it is. And just to be clear, this is not my patient. The audio is from followers of mine, and I have written permission to use this. And I'll also give you a big trigger warning before I play it. So let's listen to it, and then I'll discuss afterwards. So trigger warning, here is the audio. So there you have it. That was it. That is what we call terminal secretions, or the death rattle. And it usually happens a few hours to a few days before someone dies, hence the name. So many people hear that sound and they think their loved one is drowning in their fluids or suffering. And that is just not true. At the end of life, our brain stops telling our muscles to swallow. So one, these muscles are weakened, and two, the brain is no longer having us swallow. But our body is still creating secretions in our mouth. So those secretions are sitting in our mouth, resting there. Also, our muscles in our jaw relax. So usually the person ends up mouth breathing. So they're breathing through their mouth, and that wet air is going over those secretions, creating a gurgle. How do we know the person is comfortable if they're unconscious? It's because we are trained professionals who see this day in and day out, and we also know how to use nonverbal cues and use nonverbal scales to see if the person is comfortable or not. And 9.5 out of 10 times, the person shows us that they are comfortable, even though we're hearing that sound. So what can we do about it? We don't suction them, because the suction can create the body to make more secretions, increasing the problem. But we can give medication sublingually under the tongue to dry out those secretions if we need to. We also can just reposition the person, put their head up a little bit, turn them on their side, have the secretions come out of their mouth. Or we can just let it be and know that it's a normal part of death and dying and nothing is wrong. I hope this helps, and let me know if you have any questions. Thanks for sticking with me.